Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, and this is a series of heart lessons for each and every one of us. In this presentation, we're going to talk about what questions you need to ask if you had a heart attack or a heart disease. I am a cardiologist from Houston, Texas. I have been practicing cardiology for more than 40 years. So I will give you some tips on what are the right questions you should be asking when you see your cardiologist for the first time or the 100th time. First of all, what is a heart attack? What causes heart attack? What are the risk factors for heart attack? What are the symptoms of heart attack? Should I wait till I get all the symptoms of a heart attack? So let us try to answer some of these questions and many more. Basically, the human heart is supplied by what is known as the coronary arteries. These coronary arteries carry the blood. You can follow the arrow here. These coronary arteries supply the blood to the heart muscle. When there is buildup of a plaque known as the atherosclerosis, that's a whole new topic for another presentation. When you build up plaques here in the arteries, it narrows the arterial lumen. And in the final stages, there may be a blood clot that may form here because of the sluggish blood flow that can lead to a damage to this heart muscle. So anytime there's a total blockage of an artery, an acute total blockage of an artery, the area supplied by that region is going to die. That means the heart muscle is going to be dead. It's going to be replaced with a scar tissue over 6 to 8 weeks or 12 weeks. So that is in essence what is called a heart attack or myocardial infarction, a fancy cardiology term. Now let's get back to the questions here. What causes heart attack? We talked about it's the buildup of this plaque, which consists of cholesterol, platelets, blood cells, and smooth muscle proliferation. Okay, what are the risk factors for heart disease? All of us know what are the risk factors for heart disease. I have made a totally separate video on can I reduce my heart disease risk? There I talk about each and every one of these risk factors and what you can do to reduce these risk factors and in total how we can reduce the risk of having heart disease, especially if you have a family history of heart disease. So what are the symptoms of heart attack? People are under the misconception that unless I have a crushing chest pain, it's just indigestion. I ate this spicy food in the Indian restaurant or a Mexican restaurant, and I think I'm getting a little heartburn here. Anything that you have in your chest that you shouldn't be having, that lasts for more than 5 to 10 minutes, it should be of concern. The heart attack can present in many different forms. It could be sharp chest pain lasting for several minutes to an hour or two. It could be acute shortness of breath, or some people just pass out because of severe pain and drop in blood pressure or irregular heart rhythms. And in some patients like that, in some diabetic patients, they may not have any symptoms. So what I would suggest is you have regular checkups with your primary doctor. If there is any evidence of major risk factors, then you should modify your risk factors. And if you have any symptoms in your chest that you're normally not supposed to have, then you consult with your doctors. Should I wait until I get a chest pain, sweating, shortness of breath, weakness, dizziness, and palpitations before I call the emergency room? No. As soon as you're having something that lasts for 10-15 minutes and it's not going away, that is something new, you should be concerned. If you have access to an aspirin, you can take an aspirin and get someone else to take you to the emergency room or call an ambulance, because you don't want to be driving if you're having heart symptoms, because what if you pass out? Let's move on to the next set of questions here. Okay, let's say someone had a heart attack. has been in the hospital for 3-4 days, had a stent, and is ready to go home. Now, these are some of the questions you should be asking your doctor when you're ready to go home. Because should I go for a cardiac rehab? Yes, cardiac rehab is a great way to re-engineer your body, because all these 20, 30, 40 years, you have been putting your body through a mechanism that increased the risk of having a heart disease and a heart attack. So you need to reverse those changes, like taking care of your cholesterol in the diet, calorie intake, obesity, control of blood pressure, and control of diabetes. So you need to be focusing on all these things. And the cardiac rehabilitation is a way to improve your collateral circulation in the heart muscle, in the normal heart region, so that it reduces the symptoms and improves the prognosis. What activities can I do? I would say get engaged in an aerobic exercise. But most importantly, consult with your cardiologist before you implement anything. All that I'm doing you is giving you education as how you should be handling your heart problem. If you have ever been diagnosed, say you have a heart problem, first thing I would do is get a 200-page notebook and start making your life story in those notebooks. Write down the date you had a heart attack and find out what was the location of your heart attack, what was the extent of your heart attack, and how much damage was done. Is it 5%, 15%, 10%, or 40%? If it's a 5 or 10% damage, then your prognosis is reasonably good. If you had a 30% damage to your heart muscle, then your prognosis is going to be less compared to a normal person. So these are some of the things you should be asking your cardiologist. Activities. You should be engaging yourself in an aerobic sustained activity. What do I mean by aerobic sustained activity? You want to engage yourself in walking, brisk walking, and slight jogging. And you need to do it for at least 20 to 30 minutes. We should avoid lifting heavy weights. Why? Because when you lift heavy weights, it increases resistance. It increases the blood pressure. And that is going to strain your heart more than just regular walking or slight jogging. So those are some of the things. What can I do to lessen my risk factors? And as I said, I have a separate video on how you can reduce your risk factors and thus reduce the risk of heart disease. You're going to be on quite a number of medications. You're going to be on aspirin, and you may be on Plavix or Eliquis, some blood thinner if they put a stent. You may be on a beta blocker. And if you have a high blood pressure, you may be on higher blood pressure medications. If you have diabetes, of course, you're going to be on medications. And how often should you take nitroglycerin? This is a very frequently asked question. If after you had a heart attack, if everything goes well, hopefully you shouldn't be having any symptoms. But if you have some residual narrowing of a small branch or a small artery, then you could still have some symptoms, and that's why your doctor may prescribe nitroglycerin. Nitroglycerin is you put it under the tongue. You put it under your tongue when you have symptoms for 5 to 10 minutes, and if it doesn't go away, we recommend that you can repeat every 5 minutes for 2 to 3 doses, and if the symptoms continue, you should seek medical help. And I talked about what medications you need. And most importantly, I would make note in your 200-page history book, what are the side effects of each one of the medications you're taking? Because when you're taking aspirin and Plavix, there's a tendency for bleeding. Or if you cut or bruise, you're going to bleed longer. So you need to know what the name of the drug is, what the dosage is, and what are its effects and what are its side effects. Its side effects are more important because when you combine 3, 4, 5 different medications, the compounding effect of these medicines can give you new symptoms and new problems than what you had before. So how long should I take the medications? Well, the answer is lifelong. And what is my prognosis? Prognosis depends upon the extent of your myocardial damage. And prognosis depends upon how you re-engineer your life in the right direction, in the right path, by reducing the risk factors, getting your sugar under control, getting your blood pressure under control, bringing your cholesterol LDL to like 70 or 80 or even less than that, and then reducing your weight and quitting smoking. I mean, these are the same things we've been telling for 40 years, and it's not going to change. Will my heart condition get worse? Well, heart disease, high blood pressure, diabetes, arthritis are called chronic degenerative conditions. What does that mean? That means they slowly progress over time. But by modifying risk factors, we can delay the progression of these diseases and symptoms. So, yes, the heart condition can get worse over a period of time, but we can delay those processes by drastically reducing the risk factors. What is a heart failure? Heart failure is basically the weakening of the heart chamber or the muscle. When the heart is ready to pump, let's say it has 100 ml of blood and it pumps 70 ml of blood into the arteries. So it pumped 70 ml out of 100 ml that was to begin with. So that ratio is called the ejection fraction. It ejected 70% of the blood it received. That's the normal ejection fraction is 55 to 70%. And when people have a heart attack and there is weakening of the heart muscle, the ejection fraction drops. When the ejection fraction drops below 40, 35, 25, that's when people develop enlargement of the heart, weak, flabby heart. The heart is, instead of squeezing like this, it may be going ooh, 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 ooh. So that's heart failure. I have a separate videos on heart failure itself, and in the next video I'm going to talk about what are the right questions and things that you need to be following if you have been diagnosed with heart failure. So please do watch that video. So what are the side effects? And I told you about side effects of medications. One, they can make some of your symptoms worse. Number two, they can drop your blood pressure. Number three, bleeding problems. So keep these things in mind and talk to your doctors and write it down. Nobody can remember these things. So what do you do when you study for the exam? You repeatedly practice it. You see, that's the same thing you should be doing here also. How often do I need a stress test? Generally speaking, you don't need a stress test every year. If you had a heart attack and if you have recovered fairly well, you should be continued on medications followed up by your cardiologist. If you are having new symptoms, then you may need a stress test. There are varieties of stress tests like regular treadmill exercise test or a nuclear stress test or a stress echocardiography or a PET scan or a myocardial MRI and a whole host of things, but that's going to be determined by your cardiologist. How often do I need an echocardiogram? Echocardiogram is a very useful test to look at the heart size, the heart function, the heart valves, and the heart chamber size, all these things. We don't need an echocardiogram every year or 2 years. If your heart function is normal and if you're doing well, then the echocardiogram is going to be indicated if there is a change in your condition, or maybe every 4 to 5 years. How often do I need to change my cardiologist? I will leave that for you to answer that question. Well, this is a very quick synopsis of what I wanted to talk about, the right questions to ask for when you have a heart disease or a heart attack. This is just the tip of the iceberg. We're going to be doing a series of these kind of presentations on what are the right questions you should be asking if you have heart failure. What are the right questions you should be asking if you have a pacemaker or a defibrillator? What are the questions you should be asking if you have atrial fibrillation? That's a very important topic because atrial fibrillation is a lifelong disease. Sometimes they can eliminate with radio frequency ablation, But for the most part, it is a lifelong disease that we have to learn to live with. That means we have to learn. And what are the right questions to ask if we have a pacemaker? So please do subscribe to my YouTube channel, and I will see you in the next video. Thank you so much for your support.